Good morning and welcome to our Childhood Trauma Learning Collaborative information session about our Healthy Knowledge course, Cultivating Compassionate School Communities that Respond to Trauma Effectively. We're here today with the Director of the School Mental Health Initiative for the New England Mental Health Technology Transfer Center, Dr. Martha Staley, and me, Dana Asby, the Education Coordinator for the New England MHTTC. I'd like to acknowledge the traditional ancestral unceded territory of the Wappinger Nation, now known as the Greater New Haven, Connecticut area, where Martha and I are joining from today. Our funding comes from the Substance Abuse and Mental Health Services Administration. The views and opinions expressed in today's information session are those of the presenters, not SAMHSA. Microphones will be muted during the presentation, and at designated times during our question and answer session, you can use the raise your hand feature to request an open mic. When you are speaking, be sure to eliminate background noise. You can also submit questions for Martha and myself throughout the presentation using the chat. Registration does affirm your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat message to Ingrid Paget, our technical support manager for today's webinar. The Mental Health Technology Transfer Center network uses person-centered, affirming, respectful, and recovery-oriented language in all activities. During this information session, please ensure that whenever you are contributing to our discussion via the chat or in the question and answer section of our session, that you also use language that is strength-based, healing, and trauma responsive. I'm pleased that you joined our information session, and I'd now like to introduce Dr. Martha Staley.
Good morning, everyone. Thank you so much for joining us this morning so that we can share with you this new course that we've developed that we're very, very excited about, which really encapsulates all of the work that we've done within the C-TLC and the MHTTC over the last 3 years. So today we're going to give you a brief overview of this course called Cultivating Compassionate School Communities that Respond to Trauma Effectively. I'm going to give you a little bit of an outline about how this course will help you develop a culture of compassion in your school community and how you'll gain skills to implement compassionate school practices. And then Dana is going to tell us about how you can use this course for professional development, how to join our community of practice, and how to enroll in the course. So just a quick overview of what Cultivating Compassionate School Communities is. It's a free 12-hour online course through the Healthy Knowledge online platform, and it is for states, districts, schools, even individual educators and people interested in school mental health or school staff to help you build or refine a trauma-informed and comprehensive school mental health support system through the lens of compassion and equity. So through this course, which you can, it's a self-guided course, you can earn 12 hours of CEUs. And we also provide additional resources to help walk you through this course, including an action plan to help you guide the implementation of recommendations. As I said, there are 12 modules in this course, and we cover a variety of topics, including an introduction, discussions about the neurobiology of trauma and stress, mindfulness in the context of trauma and mental health, mindful leadership, our compassionate school mental health model, and our heart-centered learning framework, compassionate school responses to tragedies and crises, trauma-informed mental health screening, how to collaborate effectively, including student and family voices, cultural humility and equity, creating visions for compassionate school communities, and an overview of the key learnings from the course. This course is self-paced. You can go at a pace that works for you or with your group. There are pre and post tests for each module to help you measure your growth and your learning. There are a variety of additional learning materials with videos, articles, interactive virtual learning, lots of links to additional resources if you want to dive deeper into the content. We also provide some reflection opportunities to help you use these new strategies and figure out what will work in your own school context. And then we provide the action plan to help guide the implementation of the practices. In terms of helping you or guiding you to create a compassionate school community, so through this course, you and your school or district can gain a foundational understanding of the neurobiology of trauma and stress, understand the benefits of using a mindful approach to transformational leadership, consider how community collaborations can support comprehensive school mental health, community collaborations in terms of community healthcare and organizations, and how to create visions together with all of your community stakeholders, including family, students, all members of your staff and community-based organizations in your area. In terms of gaining skills to help implement these compassionate school practices, you're going to get guidance on trauma-informed recommendations for mental health screening. All of the guidance that we provide is evidence-based, and we provide the evidence for you. You will learn how to implement our heart-centering learning practices. You can see the schematic to the left of your screen, which outlines briefly what those practices are, or what heart-centered learning is, how to design crisis responses teams and plans, and how to apply the compassionate school mental health model to your needs and your communities. So all of the work within this course is based on our compassionate school mental health model, which takes a whole child, whole youth approach to supporting children and families with a trauma-informed and equitable lens. There are 4 quadrants that we address to integrate this system-wide approach, including the first quadrant, which is prevention, about reducing the causes of trauma and mental health conditions, supporting youth individually and collectively by identifying those in need and delivering resources, developing protective factors in our third quadrant, about building compassionate and equitable environments, and then helping build resiliency for the individuals and the communities that you're working with. Now I'm going to pass it to Dana to tell you a little bit more about the nuts and bolts of how you can engage with this course.
Thank you, Martha. As Martha mentioned earlier in the presentation, this is a self-paced course. However, we are developing different options for leaders to use this course with their staff in different ways. We are going to be working on an implementation guide, which will help leaders implement this course either during a single semester of the school year, the entire school year, or during a summer professional development intensive session. And we will be talking more about that in just a second. There are some ideas we have for different leaders to use this course at the state, district, and school levels. If you are a state level administrator, employees in different agencies, including departments of education or mental health, could take the course and distribute specific resources that they found most useful to their state's needs to their districts and schools. If you're a district administrator, you could take the course as an individual and do a similar resource dissemination as the state level, or you could convene a district team of either school mental health professionals, school administrators, or other educators to complete the course and distribute ideas and resources that way. If you're a school administrator, you might want your entire staff to take the course. One of the things that we always try to emphasize when we talk about trauma-informed care is that the entire staff, everyone who is interacting with a young person in the building, should be on the same page with these practices and ideas. So we do recommend that school administrators ask all staff to take the course, but if that's not feasible given the staffing time, you could convene a smaller team of school mental health professionals, other leaders, or educators to guide select staff members through the course. And one caveat that we would want to make sure to mention is that it's always advisable for the leader who is really bringing this course to their school community to take it first as an individual so that you are able to anticipate any questions that might come up or any resources that might need a little extra training for your team of educators. Now, we would love to bring you into our community of practice. We are going to offer intensive technical assistance around this course each month. Myself and Martha will be available. We help design this curriculum, and we do a lot of the training for the New England MHTTC School Mental Health Initiative. So we'll be available for an hour each month to bring together anyone who is interested in implementing this course, in the beginning of implementing this course, who has already finished implementing this course. If you have any questions about the content, about how to best roll out this implementation, about how to convince your district or state leaders to utilize the course, this is a place to come with your questions, with your challenges. And also, if you've already taken the course and had some great success, that would be wonderful for you to share your learning with others with us as well. I also mentioned that we're in the middle of creating an implementation guide for this course, and we do hope that that will help leaders better utilize the course in a more holistic professional development experience. So we are offering some guidance on coaching on these practices within that implementation guide. So that will be really helpful. We know that the research shows that coaching is very powerful in raising the fidelity of implementation. So while we can't be in your schools directly to coach you, we can give you some pretty clear instructions on how to coach your own educators. So please come join us once a month for 1 hour. Those sessions will also be recorded. So if you can't come in person, you can still register for that hour and get the recording, which could be helpful for you. And if you are engaging in our community of practice that way, please keep in touch with us via email. Everyone here today will also be invited to join our Base Camp community, which is an online resource platform where we share resources about trauma-informed education, and you can ask questions about the course there as well. So stay tuned for the date of our first hour together in November. We will definitely send an invitation to everyone who registered for this course, and we hope to see you there to help co-create our implementation guide. Now I'm going to show you how to actually enroll in the course. If you're already a member of Healthy Knowledge, then you will be able to skip a few of these steps. And if you aren't already, I would encourage you, when you do sign up for Healthy Knowledge, look around at the other courses that are available for school mental health, because there are some really great ones. So the first step to get to our course is to go to healthyknowledge.org, and then you're going to sign up as a new user. You click More under New User. That will pop up a registration page. So you will put in your name and your organization, your address, and register for the account. A new page will pop up, and it will say, you'll see this button, already have an account, but you don't. So you'll need to go to this page to register for a course and log in. Then you can put that username and password in there and log in. Then you're going to want to click Site Home on your dashboard, and you'll see a list of course categories pop up. And under that second option, Mental Health Services, you can click that little caret to open up these topics if they're not already open, and you'll want to go to School Mental Health. You can also use the search button to search for the name of our course, which is Cultivating Compassionate School Communities. If you do click on School Mental Health, these 3 courses will pop up. Ours is the first one alphabetically. So we will go ahead and click View in Description and Enroll. And then the last step to get into the course is to click this Register Now and Begin Course button. That will take you to the course dashboard, and the very first module is accessible by clicking Introduction. That will get you into the course. So I would love to share some of the mental health technology transfer resources that we do use in the course and that are available for free to everybody now before we take some questions. The first thing that's really pivotal in our creation of comprehensive school mental health systems is our National School Mental Health Best Practices Implementation Guidance modules. So when you get this slideshow, if you click on this, it'll take you to the web page where you can download these modules and access an 8-part learning series. Classroom Wise is another healthy knowledge course that the National MHTTC network developed to help educators gain mental health literacy skills so that any classroom teacher is better able to recognize and respond to mental health crises. At the C-TLC, we have a virtual training library, and it is accessible by clicking the link in this upper left-hand corner when you get the slideshow. Here we have compiled for you some of our most important full-length training videos. There are some clips from many of these throughout the course. We also have a resource directory that, in addition to some of those training videos, has toolkits, tip sheets, and blog and newsletter articles about various mental health topics. We are planning more webinars like this one, but more knowledge-based for the C-TLC, including topics on early psychosis, equity-focused school mental health, community schools, suicide prevention, comprehensive school mental health, and identifying and addressing trauma. So that's what's coming up for us. And now we would love to hear if you have any questions for us. You can type questions in the chat as well.
I hope that means everybody understands exactly how to access. Oh, good. Is there a need to, the cost is free. There's no cost for any of our resources within the MHTTC network. There is not a need to obtain parental consent before implementation. These are, this training is for you as an educator or school-based mental health staff person. And the things that you are implementing within this course would be done by staff and for the benefit of kids. Oh, I'm sorry, Dana, did you want to add?
No, I was going to say for the timing piece, we say it's about a 12-hour course, but it does vary. And there are certain sessions that are about 1 hour. Some are a little less than 1 hour. Some are a little more than 1 hour, but you can stop and save your progress in the middle of any module and come back to it. So about 12 hours is what we say. And again, we're trying to develop guidance on how to break up those 12 hours over a semester, a school year, or a summer professional development intensive.
So it's a really flexible platform and a really flexible course that you can use in a way that works for you and your staff. And there are a lot of opportunities if you find something that you are particularly interested in within the course. There are a lot of opportunities to dive deeper into that and to be hooked up to additional resources. So we hope that you will join us in the community of practice and share this information with your colleagues and consider signing up for the course and also checking out the additional really great courses available through Healthy Knowledge, again, which are all free. Are there any other questions or comments?
We have not heard specifically from any of the educators we're connected to, but the last time we checked, which was a couple of weeks ago, about 35 people had completed the course successfully. And you can sign up whenever you want. This is a self-paced course. You can start whenever. We will send registration information for the community of practice to everyone as soon as we determine the date. And yes, once you complete it, you receive a certificate of completion and CEUs. There's an option to request but one or both of those. We hope that it becomes a train the trainer idea. Yes, that would be ideal. And our implementation guide will hopefully help that happen a lot more robust manner.
Yeah, we're very, add the link in the chat to register, the link to Healthy Knowledge, or, yes, okay. I think Dana will probably do that. She's quicker than I am with that.
Yes, so you go to healthyknowledge.org and you'll get the slideshow, which has the really detailed instructions for how to register by tomorrow. But if you are excited to start today, you can just use that search bar to search for the title of our course, Cultivating Compassionate School Communities that Respond to Trauma Effectively.
And we're so glad that you're considering registering, and hope to see you online and in our community of practice. And we're just really pleased to be able to offer this course to you all, and really excited about this work. So thank you so much. If there aren't any other questions, Dana, you want to close this out?
Sure. Thank you again, everyone, for joining today's webinar. Our funding comes from the Substance Abuse and Mental Health Services Administration, which requires us to evaluate our services. Our technical support manager, Ingrid, will put the link to this very brief evaluation survey in the chat. You can also use your phone to scan the QR code on the screen. Attendees who provided their email address will receive this survey 24 hours after the close of today's event, along with today's slide presentation. The follow-up link will also email will also include a link to this presentation. We appreciate your honest, anonymous feedback, which will provide information to SAMHSA and assist us in planning future meetings and programs. For more information about the New England Mental Health Technology Transfer Center, you can visit us on our website or those social media buttons right there. And here is the New England MHTTC's email address, as well as both Martha and my emails. So please do reach out to us if you have questions about the curriculum, even if you are not able to join our community of practice. Thank you so much.